Alright, this is the informative speech. So imagine that you're sitting at home, you're watching TV, you're eating a snack, all of a sudden you get this sharp pain that goes in your chest. It's so excruciating, it starts going down your left arm and up into your jaw. You break out into a sweat, you start to feel nauseous. You know, this is the worst type of pain that you've ever had in your life, and you can only really describe it as like an elephant sitting on your chest. Starting to get short of breath, and the pain just seems to start getting worse and worse and worse. So basically you're having a heart attack at this point. According to the American Heart Association, 2,150 people die each day from heart disease, which is almost 1 every 40 seconds. Cardiovascular disease claims the life of more people than all the cancers combined. In the pre-hospital settings, a lot of people ignore these symptoms, and oftentimes can lead to some pretty catastrophic events such as death. And again, about 300,000 people suffer from cardiac arrest outside of the hospital setting, and 92% of all those people end up dying. I want to make it known that when I say cardiac arrest, I'm not necessarily talking about heart attacks. It could be trauma arrest due to something like a car accident. It could be a pulmonary embolism, like a blood clot to the lung, just for example. So cardiac arrest is usually the worst possible scenario from somebody who's having a heart attack. Their heart just stops. They don't breathe anymore. They're pretty much dead at that point. This usually is a result of somebody who starts having those symptoms, the chest pain, the trouble breathing, the nauseousness and everything, and they just kind of feel like it's indigestion, and they don't really get it checked out. But for the people that do end up calling 911, by the time we show up as paramedics, we usually see these type of people in there with those symptoms, and they just look bad. The patient is literally fighting against time at this point. When there's a clot in the heart, there's no oxygen getting to that part of the heart, and there's no blood flow getting to that part of the heart, and eventually it just starts to die. It's called ischemia. Now, my goal at this point in time is to try to help with the perfusion of the heart, to get more oxygen going to that part of the heart, to hopefully save their life from, and make sure they don't go into cardiac arrest. You know, at this, I have to act as kind of like Sherlock Holmes. I need to start looking for clues as to what the symptoms are that they're having, and determine whether or not this person really is having a heart attack. I ask them a bunch of questions and look at their overall presentation. Are they pale? Are they sweaty? And if I figure that part out, then I know pretty quickly what's going on. And at that point in time, I need to get them back out in the back of my medic unit and start doing my treatment for them. So at that point, I get them out to the back of the medic unit, I hook them up to my cardiac monitor, and I look at their EKG and see if that's a lethal rhythm or not. I got to delve a little bit further, put a couple more leads on there, and get a broader spectrum of the heart muscles. So I'll take pictures of different angles of the heart. At that point in time, I can pretty much determine whether or not that person is having a heart attack or not. So when I make that decision that they're having a heart attack, then my treatment plan starts. So I put them on oxygen, about 2 to 6 liters a minute. I start an IV on this person, and I give them 324 milligrams of aspirin for them to chew up. After I get my IV established, I can start giving them nitroglycerin, provided that their blood pressure is not too low for me to do that. So I give them nitroglycerin. Aspirin we use as an antiplatelet medication. Basically, it stops or slows down the clotting factor. So they already have a blood clot going on. This helps slow down the clotting factor. Nitroglycerin is a vasodilator. So this medication will try to open up the blood vessels so the blood can pass through the clot. And at that point in time, it's diesel therapy. We start rolling down the road as fast as we possibly can. So you'll see, sometimes you'll see us driving down the road, the lights going, blaring, or horns blaring, just blowing right through traffic lights. And at that point in time, you know something's probably really going on. So, in closing for this, time is muscle. When you have certain symptoms like this, you don't want to let them go. You want to get them treated as fast as you can, because it could be a heart attack that's going on, and worst case scenario is you can go to a cardiac arrest, and we sometimes can't fix that. So.